For decades, extreme pregnancy discomfort, postpartum weakness, and severe period pain have been dismissed as unavoidable burdens that women are simply expected to endure. This fatalistic approach overlooks the principles of structural engineering and biomechanics, treating the body's physical breakdown as an abstract biological mystery rather than a mechanical issue. A shift occurs when we treat pregnancy and childbirth as high-performance athletic feats. This perspective necessitates the same level of targeted structural rehabilitation given to elite athletes. Look at the framework used by Carlos Physiotherapeutic Care. Their clinical logo specifically includes the term sports science right at the bottom, applying high-performance athletic treatments to the specific traumas of women's health. Achieving long-term recovery requires precise, step-by-step physical therapies, each customized to address specific structural damage. Moving from vague general wellness toward precise mechanical repair provides a concrete path to improving patient outcomes. During pregnancy, the musculoskeletal framework carries an escalating mechanical load, rapidly shifting the body's center of gravity. As shown in this vector schematic, increasing anterior weight forces forces the pivot points in the lower back and pelvis into unnatural angles, resulting in debilitating pelvic girdle pain and acute lower back stress. Standard stretching cannot fix these locked joints. Clinicians must use precise mobilization techniques to physically realign the skeletal structure and relieve the mounting pressure. To address complex deep tissue tension, specialists apply myofascial release, directly targeting the layers of connective tissue that standard massage often fails to reach. We see this mapping in practice here. Under the Pregnancy Physio section, clinical interventions are specifically categorized to address pelvic girdle pain, alongside posture and back pain. Intervening mechanically during gestation stops these forces from causing permanent structural warping before birth even occurs. Childbirth inflicts extreme structural trauma upon the pelvic core, stretching muscles and ligaments well beyond their normal elastic limits. In this cross-section of diastasis recti, the stretching of the linea alba and the physical separation of the rectus abdominis muscles represent a failure of the body's anterior load-bearing wall. When that support system fails, internal organs can shift downward, leading directly to pelvic organ prolapse. Traditional core strengthening exercises require the patient to engage their muscles consciously, but that isn't always possible when the neurological connection is compromised. Biofeedback therapy allows clinicians to map those severed neural pathways, helping the patient regain conscious control over the muscle group. This list of pelvic floor therapies shows biofeedback positioned alongside EMS stimulation. If a patient's active control is entirely lost, EMS is deployed to artificially force muscle engagement and restart the recovery process. Restoring a traumatized pelvic core requires a calculated bridge between the patient's physical effort and artificial neurological stimulation. Postnatal lactation struggles are often treated as maternal failures rather than physical, correctable biomechanical alignment issues. The lactation counseling menu shown here highlights the mechanical nature of these treatments. Precise adjustments like latch correction and strategic positioning solve biological supply problems through physical alignment. This mechanical management extends to chronic conditions like endometriosis, PCOS, and recovery from gynecological surgery. Notice the special therapies list at the bottom. Modalities like TENS pain relief, ultrasound therapy, and trigger point treatments are used to disrupt the chronic pain signals caused by these internal conditions. Mapping these connections shows that internal diseases possess external musculoskeletal components that can be manipulated to provide physical relief. Stigmatized issues like vaginismus or urinary incontinence are, in a clinical setting, standard musculoskeletal dysfunctions that are highly treatable. Your first step is identifying your exact stage of recovery and separating a general sensation of pain from a specific mechanical failure. As a rule of thumb, if the weakness affects your overall balance, you likely need general core work. If the issue involves organ support or continence, it requires isolated pelvic floor training. This infographic provides the vocabulary needed for your next medical appointment. By asking for specific modalities like myofascial release or biofeedback, you can advocate for technological solutions rather than accepting generic advice. This requires a psychological shift, moving from a passive sufferer of biological destiny to an active mechanic of your own body. Mastering the biomechanics of womanhood provides the logical foundation for reclaiming lifelong physical autonomy.